presenting the first affirmative for the topic of raising the smoking age federally to 21. So current laws fail to sustain the health of the younger generations, and we should raise the smoking age federally in order to provide better environments for these children. This law does include vaping, hookah, and electronic cigarettes, which I'm going to refer to as e-cigs as well. For my significance claim, I put that smoking typically begins at a young age. So many adults begin smoking before the age of 21. A statistic says that 90% of smokers began smoking before the age of 19, according to the Centers for Disease Control and Prevention. And also according to them, young people want to fit in with their peers. Images in tobacco marketing are making tobacco use look appealing to this age group. So those who begin smoking young continue to smoke usually. So the National Institute on Drug Abuse states that about 30% of teen smokers will continue smoking and die early from a smoking-related disease. Smoking also leads to the use of other drugs. According to the Surgeon General, teenagers who smoke are 3 times more likely to use alcohol, 8 times more likely to use to smoke marijuana, and 22 times more likely to use cocaine. So the CASA, which is the Center on Addiction and Substance Abuse at Columbia, they did a study that establishes a clear progression that begins with gateway drugs and leads to cocaine use. Nearly 90% of people who have ever tried cocaine used all 3 gateway substances, which were cigarettes, alcohol, and marijuana first. More than half followed a progression from cigarettes to alcohol to marijuana and then on to cocaine. The second is my inherency argument, which is about smoking, which is referring specifically to vaping and electronic cigarettes and hookah smoking. So this has become a more recent trend, as I'm sure all of you know. So the Centers for Disease Control announces that e-cigarette use among U.S. and middle and high school students doubles between 2011 and 2012, mirroring a similar increase in adult use. Jillian Mincer of Reuters discusses a poll they conducted and found that about 10% of U.S. adults now vape, according to the online Reuters poll of 5,679 Americans conducted between May 19 and June 4th of 2015, which is almost 4 times higher than a U.S. government estimate that 2.6% of adults used e-cigarettes in 2013. Not only that, but these are very dangerous substances. The Centers for Disease Control and Prevention states, similar to cigarettes, hookah smoking delivers the addictive drug nicotine, and it is at least as toxic, if not more, as cigarette smoking. While many hookah smokers may consider this practice less harmful than smoking cigarettes, hookah smoking carries many of the same health risks as cigarettes. The Washington Post states that e-cig vapor can also contain lead, cadmium, nickel, tin, and other metals, which can cause nervous system or respiratory problems, and some flavoring chemicals, such as those used to create cinnamon flavor, can be extremely toxic. The Washington Post also claims that when propylene glycol is heated, it can degrade into formaldehyde, a chemical linked to nose and eye irritation, and an increased risk of asthma and cancer. The Center for Environmental Health recently tested 97 e-cig products and found formaldehyde and the chemical acrylaldehyde in more than half of them. Also, not only that, but the long-term effects of this is very unknown. The New York Daily News interviewed Dr. David Samadi, who states that it's not the medical data that is as disturbing, but the lack thereof. There have been studies evaluating their safety, and the FDA has performed numerous testing around the chemicals, but almost no clinical trials have been performed to determine long or short-term health effects. The Cleveland Clinic states that researchers know that the nicotine contained in cigarettes constricts blood vessels. However, they do not yet know the cumulative damage e-cigarettes cause to your heart, lungs, and blood vessels. Many experts urge everyone, heart patients in particular, to avoid smoking any product, including e-cigarettes. And also, for those of you who don't know, Hawaii recently passed a law beginning of this year, and I'm just going to give you a brief view of their violations, which are individuals violating the law by smoking under the age of 21 will be subject to a $50 fine, and individuals selling to those who are under 21 will be subject to penalties ranging from $500 to $2,000. So for my solvency, we're going to use Hawaii as an example. There's also other cities and counties that have passed the law throughout the U.S. So roughly, the statistics before the law was passed was that roughly 5,600 kids in Hawaii try smoking every year, and around 86% of adult smokers across the state had their first cigarette before turning 21. According to the Washington Times News, the Campaign for Tobacco-Free Kids has claimed that about 1,400 people die annually in Hawaii from either first or second-hand exposure to cigarette smoke, also written in the Washington Times. So predictions with the passing of the law, since there hasn't really been any statistics made therefore from the other states and countries that have passed this law, since it's so fairly new. So a study was done by the American Academy of Pediatrics that shows that setting a new minimum age nationwide would result in nearly 250,000 fewer premature deaths and 50,000 fewer deaths from lung cancer among people born between 2000 and 2019. The biggest reason to raise the legal age to 21 is to reduce young people's access to tobacco when they are more likely to become addicted and when their brains are still developing. Studies have found that nicotine, the main addictive ingredient in cigarettes, can impair cognition among young people, according to the New York Times. Thank you.